Hello and welcome to Health Matters. I'm your host, Dr. Michael Chillemi. On this episode, what we're going to talk about is gout. So, gout is going to be part of the series on arthritis. We are going to take a deep dive into gout. And this is episode 3 in the series of arthritis. So, we did osteoarthritis, rheumatoid arthritis, and now we're going to do gout. So let's jump right into it. Gout is a common and debilitating form of arthritis that can significantly impact the quality of your life. Whether you're dealing with gout or know somebody who is dealing with gout, or you want to understand it better for yourself, we're going to cover symptoms, common causes, diagnostic steps, and a variety of other options with an emphasis on holistic and integrative approaches practiced at our center today. Okay, let's jump right into it and shine a light on gout, a condition that people have been dealing with for centuries. Gout affects over 8 million people in the United States alone. At the Health and Spine Wellness Center, we strive to go beyond just managing symptoms. We aim to understand and tackle the root cause to provide long-term relief and improvement for your overall well-being. What is gout? So gout is a form of arthritis, and it's an inflammatory arthritis. It's characterized by sudden, severe attacks of pain, swelling, redness, tenderness. Could be in one joint or multiple joints. It's most often goes after the big toe. An attack of gout can occur suddenly, often wakes you up in the middle of the night with the sensation as if your big toe is on fire. The affected joint is hot, swollen, and so tender that even the bed sheet alone makes it seem intolerable. I've actually had patients that told me this, and I've had that early on in my practice, where it really can be as textbook as that. Patient came in with that exact symptom of, I was laying in bed and the sheet alone made me jump off the bed because it was so painful. Now, I'm not talking the big heavy bed sheet. I'm talking about the undersheet. That's how soft and that's how painful that it can be. So gout symptoms may come and go, but there are ways to manage the symptoms and to prevent flare-ups. So what is gout? Gout is caused by an elevated levels of uric acid in the blood, which can form sharp needle-like crystals called urate crystals. It can affect the joint and the surrounding tissue, causing pain and inflammation. The primary cause of hyperuricemia, which is the leading condition causing gout, is the body's inability to effectively remove uric acid through the kidneys. This can result in uric acid accumulation, forming these crystals. Gout attacks typically are sudden and mostly at night, and are typically triggered by certain foods, alcohol, stress, and other underlying health conditions. So what are the common symptoms for gout? These symptoms are pretty much unmistakable due to the sudden and intense pain that always occur suddenly when they come. And like I said, most of the time they are at night. Let's break down the symptoms of it. So when you get these severe sudden joint attacks, that's typically the hallmark of a gouty attack. The pain comes on so fast, and like I said, mostly at night, that this pain will wake you up. The intense joint pain mostly affects the big toe, but it can affect any joint. Other common joints include the ankles, knees, elbows, wrists, and fingers. The pain is likely to be severe within the first 4 to 12 hours after it begins. Some of the other symptoms are lingering discomfort. After the most severe pain comes and subsides a little bit, some of the joint discomfort may last from a few days to a few weeks. Later attacks are likely to last a little longer and affect more joints, so it gets progressively worse. Inflammation and redness are also associated with gout because the joints become tender, swollen, and when they get swollen, they usually get red. You also typically have limited range of motion as the gout progresses. You may not be able to move your joints normally. May become stiff. Other possible symptoms can happen are fever. Sometimes with gouty flare-ups, you can have a mild fever. Sometimes you could also have a general fatigue, feeling a little bit underwell, or that they're just tired symptoms. When we talk about gout, some of the terms that we want to talk about, there are two big ones, podagra and tophi. When we hear the term podagra, that's the medical term for an acute attack of gout. It means it's a new form of gout that just happened right now. So it's acute, it just happened. Typically, podagra is affecting the big toe, where tophi are hard lumps that form in the soft tissue around the joints. Both are symptoms of gout. And again, gout is a type of arthritis that is caused by high levels of uric acid. So when we talk about podagra, again, I want you to think of the big toe. And it is a painful attack that affects typically that one joint. And that joint is the big toe. When we talk about tophi, those are deposits of uric acid crystals that form in and around joints and tissue, typically with people with gout. When we have chronic or reoccurring gout, they tend to develop over a longer period of time. So the tophi takes time to develop. Chronic gouty arthritis is typically what we're talking about. And you get those firm, gritty bumps around the joints, hard lumps. All those hard lumps are buildup of uric acid that form around those joints. They can develop in all the joints, but especially your big toe, your fingers, your feet, your elbows, your Achilles tendon. Those are mostly common with gout. Some of the causes of gout are the accumulation of the uric acid crystals, causing inflammation and intense pain. When you have the uric acid crystals form, they tend to raise the uric acid in your blood. Your body's ability to kick them out through the kidneys is decreased. Then your body breaks down the uric acid. It produces purines. Purines are naturally found in your body. And purines are also associated with certain foods, including red meat, organ meat, such as liver. Purine-rich seafoods include anchovies, sardines, mussels, scallops, could be trout, tuna. Alcoholic beverages are another thing we have to look at when we're talking about gout, especially beer. Drinks that are sweetened with high levels of fructose increase the level of uric acid. Normally, uric acid can just dissolve in your body through the kidneys. But when your body produces too much or your kidney can't process the uric acid and it kicks out too little, then you have that buildup of uric acid. And that buildup is what causes those sharp needle-like crystals around the joints, which cause all that pain and inflammation and that severe pain. So what are some of the risk factors you're more likely to develop gout is having the high levels of uric acid. So dietary choices, we definitely want to eliminate purine type foods, which includes, again, red meat, shellfish, and organ meats. Those are typically the main food factors that can increase your chances of getting gout. Drinking, especially alcohol, especially beer and sugary drinks with high levels of fructose and corn syrup are the biggest culprits for gout. Weight management, obesity, the more we weigh, our ability for our body to break it down can decrease with the effective efficiency of the kidneys decreasing. So we want to make sure we keep our weight under management. Medical conditions, there are certain diseases that can raise your levels of gout. So if we have something like hypertension, that can contribute to increasing the body's inability to break down uric acid and the ability to raise the level of gout. If you have diabetes, type 2 typically increases your levels of uric acid. So when we have diabetes, our kidneys are definitely going to be affected. Some metabolic syndromes can cause problems with gout, and then that can affect your heart, and your kidney diseases can also affect gout. Sometimes medications in low doses are used to control certain drugs to help with gout. Some of the drugs that are used to help decrease them are things that you want to definitely watch out for. So some of the things that you want to watch out for with certain medications are ACE inhibitors that can increase your level of gout, because by increasing your level of uric acid. Drugs such as low-dose aspirin and certain diuretics usually to treat hypertension can actually elevate your levels of uric acid. Some family histories, genetic factors. If you have a family history of gout, you are more susceptible to developing this condition. Can age and sex affect your gout? Gout affects primarily men. Women typically have lower levels of uric acid, especially after menopause. However, women's uric acid levels approach those of men when they're usually earlier on. So like between 30 and 50, it's closer. It's still more men than women, but there's a higher level of women from 30 to 50. As women have menopause, that level decreases in women and increases in men. If you had recent surgery or trauma, that can sometimes trigger gouty attacks, because some of those medicines can cause your body inabilities to break down that uric acid. Not drinking enough water, being dehydrated, can raise your level of uric acid. If your kidneys aren't functioning well and you can't flush your kidneys, then that can raise the level of uric acid in your body, which can lead to people having gout. So when we have reoccurring gout, people may experience signs and symptoms over and over again. Other people may experience gout once in a while, once a year, but it is important that people that have attacks or recurring gout, if left untreated, can cause erosion and destructions of joints. So it is critical that we definitely get the right medication and treatment for it. Advanced gout, if you untreat your gout and you have uric acid crystal deposits under the skin and that tophi around your fingers and joints, those could be hard to go away. and it can be very, very painful. So you want to really make sure if you're getting those signs and symptoms, you actually take care of yourself. Kidney stones, sometimes urate crystals may collect in the urinary tract with people with gout causing those kidney stones. Medications can definitely help reduce the risk of kidney stones. So how does somebody diagnose gout? Accurate diagnosis of gout is crucial for the effective treatment. So typically the steps that are taken are you want to make sure you have a good medical history. So make sure your doctor does a complete history review, reviews your dietary habits, your medical history. Your doctor needs to do a detailed physical examination, careful examination of your affected joints, especially your toes, your fingers, and any of those areas. Blood tests, measuring your levels of uric acid in your blood can suggest gout. Well, they are not definitive, since sometimes people without gout can have higher levels of uric acid. That is a test you can to do. So when you're putting your whole picture together of the patient, you want to put everything in there, your history to your physical, to your blood tests. These tests, the blood tests specifically, are very, very helpful in diagnosing gout. X-rays can help rule in or out an inflammatory condition. Ultrasound, DEXA scans, all these things can help detect, confirm, or non-confirm gout. So what is some of the treatment and prevention that people can do to reduce pain and inflammation in gout? And especially during those acute attacks, to lower your uric acid, right? So you want to lower your uric acid. Medications such as non-steroidal anti-inflammatory drugs and corticosteroids are commonly used into decreasing some of the effects of gout. Long-term management may include different medications, allopurinol and Phebostat are used. There's a lot of other medications out there as well, but you want to use, talk to your doctor about what's the best medication for you. Each person's a little bit different, but your doctor will have to determine what works best for you. Preventative measures and lifestyle changes are always smart in thinking about reducing your levels of gout, decreasing those purine-rich foods, decreasing those alcohol levels, staying well hydrated, having an exercise program, weight management, all that stuff together is critical in uric acid reduction and gout management. A variety of options that we use in our office here at the Health and Spine Wellness Center. We want to advocate holistic and an integrative approach to managing conditions, especially something like gout. So when we take a detailed look at lifestyle changes, dietary, we want to look for foods that are low purine options like fruits, vegetables, whole grain, lean proteins, staying hydrated, drinking water. We talked about how much water in one of my previous videos. Weight management. Losing weight can decrease levels of uric acid and stress on the joints and the body. Utilizing physical therapy, customized therapy sessions can help maintain joint mobility and strength while supporting the muscles around the area. Of course, chiropractic adjustments, getting your spine adjusted and getting your extremities adjusted, keeping the fluid moving in your joints is critical. Movement is life. The more we can, I'm going to say adjust and treat the different joints. We want to keep that function throughout our joints. So chiropractic is one level to do that. Utilizing PRP therapies in concentration in some of your affected joints can affect and treat and help heal some of the tissue around those inflamed and damaged areas. Nutrition. What are some nutritional things that we can do to help with gout? So cherry extract is a great choice to help reduce the uric acid, taking a good amount of vitamin C, fish oils. All these things help reduce gout type symptoms. Stress management. Sometimes stress can exacerbate your gouty conditions. So if we manage our stress, we're going to decrease our inflammation in our body, keeping our cortisone level low, right? So as stress increases, our cortisone level increases. As our cortisone level increases, that can affect your gout. So again, those mindful techniques such as yoga, stretching are very, very important into managing those type of conditions. Understanding and managing gout is a multifaceted process, but with the right knowledge and the right holistic approach, it is possible to lead a relatively pain-free life. The team here at our center, the Health and Spine Wellness Center, is dedicated in helping you achieve your optimal health through our integrated practice and through our group approach of actually treating patients, the whole patient. It is critical for you to get treatment and in a facility that actually looks at you as a whole patient. If you are struggling with gout, or you know somebody who is a friend, family member, brother, sister, uncle, mother, father, please pass on this podcast so they can have a little better understanding of what's out there, what they might want to look out for, how they can help. And if we could be of any assistance, please go to our website, healthspinewellnesscenter.com, or call us 973-759-3020. We'll be happy to help. Don't forget to subscribe and share this with anybody that you could think can benefit from it. And I'm going to end with saying this. My opinions here are just that, my opinions. This is not meant to be medical advice. This is not meant to be medical treatment. Your individual condition is up to you, the patient, to get to the right provider, to get to the right diagnosis. This is just for informational purposes only. These opinions are mine and mine alone. I wish you the best of health. And I wish you a happy and healthy life. It is your life. Be there healthy because health matters. Till next time, have a great day.